Welcome to our Comprehensive Oral Assessment and Treatment module of the eCampus. In this, we are going to talk about how to do a complete oral assessment and treatment of a patient. So to start off with, we have an awake patient of which we perform an oral evaluation looking at all the teeth, the occlusion, the gums, the tongue, and we record all of that on the dental chart. We use the European Veterinary Dental Society's website for this. Please see one of the staff members if you don't know how to use this program. We then look at anaesthetising our patient, obviously, so they don't chew on our radiographic dental plates, and we take radiographs of their teeth. Now, in cats, particularly any cat over 8 years of age, we do recommend a full mouth series. In younger animals, we may probe first before we take radiographs. But the main thing is that the radiographs are taken. If we don't take them, then the client needs to know why we didn't take them. There are standard views of the skull which we can use to look at general anatomy, but they don't really give us much detail on dental pathology. So the standard of care is actually to use intraoral radiographs, which is our little CR7 unit and handheld generator that we have in our dental suite at Prahran Veterinary Hospital. The next thing that we do is we scale the teeth. So we look at using an ultrasonic scaler and also hand instruments to clean above and below the gingival margin to make sure that we get all of the calculus away from the tooth. And as a general rule, ultrasonic scalers should not go under the gum. They do vibrate at a very high frequency and generate quite a lot of heat, and they can be quite traumatic to tissue. It's much gentler to use hand instruments under the gum. We then look at polishing, so we polish the teeth with a low-speed hand piece, and some of these hand pieces will oscillate backwards and forwards, and they're much better in dogs and cats because they don't catch hair and wrap it up around the head of the polishing cup. Some of them will still go around and around, so you do need to be careful when you're operating near hair around the mouth. We then irrigate the areas, and we do this with the triplex head just to remove any debris or loose calculus that we might not have pulled out from underneath the gum margin. We don't want to leave that in place, and we don't want to leave any polishing paste under the gum as well. We then inspect all the crowns and the subgingival areas again. Using a periodontal probe, we will then look at examining the periodontal pocketing around the teeth, and anything below above 2 millimeters is considered abnormal. It's considered abnormal and indicates that there is bone loss there. If you haven't already, you would then take radiographs of that area. Treatment is based on our assessment, so we will do periodontal therapy and extractions based on the radiographic findings and probing that we have done. We perform periodontal surgery to remove deep debris, eliminate pockets and or extract teeth. And the pockets in the gingival recession is, if the pockets in the gingival recession are more than 50% of the tooth root, then unfortunately there is probably not enough tooth root to support the tooth long term, and extraction is indicated. Certainly if you wanted to do periodontal surgery, that is something that you need to be trained in. It can be quite complicated and involves lifting gum flaps and cleaning under the tooth and then stitching the gum flaps back down in place. Antibiotics, perioperative antibiotics are a controversial subject in veterinary dentistry. Whether we give them parenterally or locally, there are local delivery systems now which involve chloronic gel, which we get in from a compounding pharmacist, that can be mixed with gentamicin or doxycycline and placed under the gum and then sutured in place. But oral antibiotics can still be used, like amoxiclav or clindamycin. And then we have convenia, which is what I tend to use a lot, because it means that we're not administering oral antibiotics to potentially painful patients after dental surgery. Biopsies should be taken of all abnormal masses or grossly abnormal gingiva in the mouth, and that should be submitted to laboratory for pathology. It is really important because sometimes epulides or epuli can look very similar to squamous cell carcinomas or early oral melanomas. So it is important that we do biopsy them and give the option of further workup. Post-extraction x-rays are really important. I can't stress this enough. And why do we do them? This is why. We can look at this tooth that has been supposedly extracted in another clinic. There are at least 3 dental roots left in place, and there is periodontal apical pathology around this root here and this root here. So these teeth are infected still, and there is infected material there, and this will go on to cause long-term chronic low-grade pain for this patient, and the infections will sort of rupture out through the gum and cause draining sinuses and fistulous tracts. So if we do leave a root in place, and there are reasons why we do, particularly in cats, having an x-ray and knowing they're there and explaining to the owner why they were left in is really important. Can't stress that enough. Also, if you do accidentally punch a tooth root into a nasal cavity, it's really important that we are then able to go and find it and remove it rather than leaving it in place and causing long-term problems. Sealants can be used, and what these are materials that help to seal the gingival sulcus down to stop calculus from forming back underneath the gum again. They can be very helpful in cases of periodontal disease, or if you have a patient that develops calculus and plaque very, very quickly after their dental cleanings, and they last for 3 to 6 months. They need to be applied under anaesthetic, so we do need to think about them in that respect. Then we flush the oral cavity, we remove any packing material, which is obvious, and make sure that there's no foreign debris or blood or anything on the mouth, because waking up with a mouthful of blood is really revolting, speaking from first-hand experience. So the last thing that we need to do is to provide home care. It's really important to make sure that we follow up at home after the treatment is done. 80% of the work is done at home. We will clean the teeth and get them back to clean, but then trying to prevent this from happening again is really, really important. And that's where our 3 monthly checks come in. That's where home care and brushing and foods and all of those things that we talk about in other sections of this eCampus are so important. So please, please, please remember to make that home care program available to the client, and also take into account what the client and the patient is able to tolerate. Thanks for listening.